So riddle me this. How come the US spends more money on healthcare than any other nation on this planet, and yet we rank as one of the lowest in life expectancy among the wealthiest nations? My name is Phil Benoist, and I'm all about embracing retirement with purpose, passion, and new beginnings. But I got to tell you, I am becoming more and more disillusioned of our healthcare system as I grow older. I used to joke about never going to the doctor, never seeing a doctor. Last time a doctor ever saw me was when I was born. Never got vaccinations, hadn't had blood tests decades. And if I got sick, I just pushed through it. I mean, I am not proud of that at all. But that's the way I was. And things changed when I turned 60. I had a situation with my eye. It was a retina vein exclusion or something. Essentially, it was like a blood clot in my eye. And, I went blind there and I was very, very fortunate that it was able to be repaired because I know people are walking around this and they just have to get injections every 4 to 6 weeks to stop them from going blind. And I'm lucky I don't have to have that. But the bottom line is that really kind of pushed me back into that healthcare environment. And it was also kind of a rude awakening. I expected something different, something, I don't know, like more caring for my wellness. But what I found was that it was more of not preventative, but it was more, let's just fix the illness. And that is one of the things that I have discovered that is different between the US and other countries. They focus on preventative care. That's their number one focus. And it's really interesting because we have gotten really good at insulin, at surgeries, at stents, but we have not got good at preventative care. We're not there yet. And that's one of the big things. And another one is simply what I would say our healthcare system, our insurance. We have Medicare, we have Medicaid, we have private insurance, and yet millions of people still go uninsured and they just simply cannot afford to go see a doctor. And that is also resulting in early deaths and it's bringing our life expectancy down. Whereas other nations, they guarantee this coverage. And again, I'm not trying to be political, but I'm just citing the facts that we have a low life expectancy rate. Other countries guarantee coverage. Put the two and two together, might figure out that there is a relationship there. We have a fragmented insurance system as well. I mean, we have so many different insurance companies out there, different billing codes, different rules. I read often where your individual is fighting with an insurance company to get coverage and they're being denied. I even went through that when my mom had cancer. This was, decades ago. She died from lung cancer. And I remember having to fight with the insurance company at that time. Thing is that the insurance companies, the healthcare industry in general, is just simply not going to change overnight. So, what can we do? Number one, we need to prioritize our prevention. Don't skip on the screenings, don't skip on the vaccinations. Stay up to date with your wellness visits. Take your lifestyle seriously. Take a look at the Mediterranean countries. There's a reason why they are some of the healthiest countries out there. Look at their Mediterranean style diet. Yeah, I'm sure that you've heard that the Mediterranean style diet is one of the healthiest out there. I mean, God, anytime if you just type in diet in Google, that's the number one diet that's going to come up. They recommend that more than any other diet. Or what I would say is, your new eating lifestyle. Start walking regularly, start a strength training, resistance training. You need to take your lifestyle seriously. Know your numbers. I mean, do you know what your average blood pressure number is? If you don't, I'm going to highly recommend you go out and you buy a blood pressure machine. I take my blood pressure 3 times a week and I'm staying on top of that. Do you know what your A1C level is? Do you know what your blood sugar is? Do you know what your cholesterol numbers are? Be on top of these things, okay? Be on top of them. Stay socially and mentally active. I've always talked about how important it is to be a continuous learner, learn new things that's going to keep you mentally active, but socially active. Join some groups, start volunteering, just get together with friends. That is so important as well. I mean, there's meetup events, there's all kinds of things that can help you stay socially active. Finally, advocate for yourself. You go to the doctor, ask questions. Don't assume that they know everything. And if they're telling you something that just doesn't feel right, not only question it, you might even want to get a second opinion. Don't be afraid of asking for second opinions. It's common. So, in a nutshell, there are some strengths with our healthcare system, but there's some deep flaws as well. And these things are not going to change overnight. So, we need to be advocates for our own healthcare. And one of the best things to do is to be aware and to start taking control. I hope you found this video helpful, useful, informative. If you haven't done so already, please make sure that you subscribe to this channel. Hit that bell notification as I do upload new videos every week, and I'd hate for you to miss one. Thanks again for stopping by, and I look forward to talking to you next week. Take care.